Hello, I'm Dan Klimek with Siskin Company, and today our safety meeting is on caring for your back, or basically preventing back pain. The first thing we need to take a look at is just a little bit on how the back is, let's say, designed or the structure of the back. And one of the things you'll notice on the graphic is that the back has kind of four distinct areas. The area that I'm really going to talk about is the lower back, the lumbar area. That's where we tend to have most of the back pain. We can have back pain at any point in our back, but the lumbar area is really the area that most people will suffer and feel back pain in. And the reason for it is shown here. If you carry a 20-pound load, what you actually see, and it's carried 20 inches out in front of the body, there's a compressive force on the back of 400 pounds. And you might think of that and go, how can that be? Well, the reason it is because our back really works as a lever arm. If we have a lever where you have 10 pounds on one side, the fulcrum is right in the middle, and you push down on the other side of that lever arm, and think of kind of like a kid's teeter-totter, it takes 10 pounds to push down to raise 10 pounds on the other side. But our backs are made as a 10-to-1 lever arm. So you have a 10-pound weight on the far side of that lever arm. You push down on the short part of the lever arm, and you actually have to exert 100 pounds of force to overcome the weight. And that's a key concept, because that lever arm of our back, anytime we bend over to pick something up, we're multiplying the force that the muscles and all the structures of the back have to exert to stand back up. We're not just lifting 10 pounds, we're lifting 100 pounds. And that's what the back sees. The other thing that makes a difference is the weight of our torso. This diagram shows, if you have a person that has a 100-pound torso or 105-pound torso, they're going to pick up a 100-pound or a 100-pound item, that the back is seeing 1,150 pounds of force. Now, you add 20 pounds to the torso. A few of us are a little overweight, so we carry some extra weight with us. We never really think about the extra force that our back is experiencing just for us to stand up. The fact that we're straightening our back up. So those are two key concepts. That the weight of the torso has significant force on the pressure that the back feels, and then the weight we carry. And the closer we carry the weight to our body versus carrying it further away makes a huge difference with how much force our back sees. And again, we've talked about this, that due to the design of our bodies, depending on how we lift, makes a huge difference. So if we're active, we keep our backs in good shape, we try to do things to care for our back, it makes a big difference. You've all heard things like lift with your legs instead of your back. The idea with it is very strong leg muscles. Try to keep your back in a good position. It minimizes the forces on the low back. Keep the load close to the body. You have something out here, the back is experiencing more force, more torsional forces. Keep it in close, less torsional forces. Avoid lifting and twisting the back. If you're going to tear a piece of paper, what's the mechanism you use? You tear it. You kind of do a twisting action. When we twist and lift, we're putting those same kind of forces on our back. It seems awkward to go sideways, step, and set something down. But from a back care point of view, it makes a tremendous difference. Sizing up the load before you lift. You're going to take something out of the back of a pickup truck. How much does it weigh? Can you realistically lift it? Size up the load. Give a little feel. Can I really handle it? Get help or use mechanical lifting as much as possible. We've already talked about using the legs. The legs are tremendously strong. However, keep in mind that you still have joints. So physical manual lifting of heavy items puts wear and tear on different joints. It's important to understand what joints are we using. Are we doing things like giving ourselves rest? And maybe we need to do some things to help prevent injuries. Things like back bends. Do we bend forward? Do we bend backwards? Those are the kind of things that can help redistribute the tissues inside the back that we never see and usually never think about until they hurt. Same type of things occur with legs. Are we giving rest? Are we stretching? Are we moving? And one of the key things with lifting is this. You use mechanical aids as much as possible. If you have a crane, if you can use some kind of a lifting aid, that all helps with preventing back pain. To maintain a healthy back when we're lifting, and there's other things we can do for standing, sitting, driving, whatever, but for lifting, we want to check the weight. We want to be in a proper position. Be ready, be strong, tighten the abdominal muscles, spread the legs, and be ready to pick that load up. A wide base so that our feet support our body. Our back has some natural curves. We want to try to keep those natural curves. Again, firm stomach muscles, the idea of inter-abdominal pressure helps straighten the back up. And if we do smooth, controlled movements, we're more likely to not experience sharp tears that happen to the muscles and the tissues of the back. Some other things that we don't think about often is the idea of smoking. Smoking cuts down on blood flow. Smokers tend to have more back pain, take longer to heal than non-smokers. People who eat correctly tend to have better health, their overall body functions better because they're drinking more water, they're eating more substantial foods, and they're not just living on beer and sugar and those type of things. And then stress. We need to control stress in our life for a number of reasons, but if we're always tight and tense about things, we tend to not be able to let our muscles relax to the point that they get a chance to rest between lifts and some of the other activity we might do. So in review, back injuries are a likely cause of injury, and all of us at some point in our life are going to experience back pain. How serious it is sometimes depends on how well we've prepared ourselves and what we're doing for nutrition and care of the back. You need to keep in mind that the back is under tremendous force. We don't think about it, but just normal movements, normal bending. The idea of bending over to pick up that sheet of paper. You're not just picking up that sheet of paper. You're picking up 800 to 1,000 pounds when you're trying to stand up with your torso. You want to pay attention to the body movements, especially in terms of how you lift. So you want to have smooth movements. You want to be thinking, if you're bending down to pick something up, ask yourself, how did I get here? What shape, what kind of condition are my legs in? What position are they in? When I stand up, am I going to lift with my legs or am I going to try to hoist it up with my back? And we can just take simple steps. Make sure we have good posture. We want to do stretching and back bends to kind of keep the joints all fluid. And again, non-smoking. There's a lot of health reasons for not smoking, and the back and healthy backs is just one more reason smoking should be avoided. This presentation is available at www.gomsca.org.